Next, I'm going to assess the patient's breast. I'm going to ask them to lie down flat and raise their arms above their head. I'm going to note the appearance of the nipples. I'm looking for any dimpling, any cracking in the skin. There shouldn't be any lesions or discharge. So starting at the nipple, I'm going to gently palpate in a circular motion, going from the nipple, working my way out, looking for any tenderness or any masses. Next, I'm going to palpate the axillary nodes. They should be non-tender and non-palpable. Moving on to the abdomen, I'm looking at the symmetry of the abdomen. It could be either rounded or flat, depending on the person's body size and shape. I'm looking to make sure that the skin is intact. I'm looking for any abnormal pulsations, any hernias around the umbilicus or in the inguinal region. I'm going to go ahead and auscultate bowel sounds in all 4 quadrants using my stethoscope, noting whether they are hypoactive or hyperactive. Next, I'm going to palpate all 4 quadrants, noting any tenderness or swelling. Next, I'm going to percuss the liver at I'm going to percuss the liver's margin at the level of the right midclavicular line. So I'm going to place my non-dominant hand just below the level of the ribs and sharply percuss. You should be able to hear some dullness over the liver, but it should not be abnormally distended. It should not extend more than 2 finger breadths down below the rib cage. Next, I'm going to palpate the spleen. It should be non-palpable. I can place my left hand across the patient, push up, and I should not be able to palpate the spleen here. Next, I'm going to assess the pulses. I'm looking at the aortic pulse. I can take both hands and place it just over the aorta, and I should be able to feel it pulsing, but it should not be greater than 3 centimeters. You're assessing for any abdominal aneurysms here. Next, I'm going to palpate the femoral pulses bilaterally. They should be present and they should be strong. Next, I'm going to assess the bladder. I'm going to palpate just over the symphysis pubis. I should not be feeling any distension. I'm going to assess the patient's urinary status. Their urine should be clear and yellow, and they should have no difficulty voiding. Next, I'm going to assess their bowel status. I'm going to ask the patient the date of their last bowel movement, and if we're taking a sample, then I'm going to make sure that it's soft and brown, making sure that it's not of any abnormal consistency or color. Next, I'm going to assess the lower extremities. The skin should be intact and slightly more pale in comparison to the rest of the body. Looking at the toenails, they should be white and smooth. I'm going to assess capillary refill on both feet, making sure that blood return takes less than 3 seconds. Next, I'm going to assess for any edema, which could indicate problems with the cardiovascular system. A lot of dependent edema will be seen around the ankles or calves. Next, I'm going to assess range of motion in the ankle. They should be able to flex, extend, and rotate both ankles. The knee should be able to flex and extend without any crepitus or any pain bilaterally. I'm going to assess the pulses. So the popliteal pulse should be palpable just behind the knee. Should be present bilaterally. Next, I'm going to do the posterior tibial and the dorsalis pedis, which is on the top. Next, I'm going to ask the patient to sit up while I assess the patellar reflex. So I would have them sit up with their knees hanging off the edge of a chair, and you can take the reflex hammer to elicit the patellar reflex. It should not be too strong or too weak.